I'm really excited that we are, like joining back again for our second set of conference. So, Illuminate AI's second conference in 2022, and we have a great lineup of speakers for the event. So, based on the previous experience that we had, like last year when we had the conference, it was 1 day long of conference, which was probably too long for a lot of people. So we decided to break it up in different days. So the way that we're going to have this conference this time is that it's split between 4 different days. So we're going to kick off the conference today, and we're going to have one session by Eden Waller. And then tomorrow we're going to again meet at 8 a.m. PT, 8 a.m. PT, and then have two more sessions. So we're going to have that tomorrow, day after, and on Thursday. So the conference is like split in 4 different days. People who are joining me through LinkedIn, thank you so much for being here. Do mention like where you're tuning in from, like which country, which city. And I see that a lot of folks are also tuning in from YouTube. One of the things I would highly recommend is that you go to LinkedIn and join us through LinkedIn. The reason being is that we are going to have trivia. So we saw that a lot of folks were really keen on learning more about the Between the Spreadsheets book, because that's something I read, and I wrote a review about that. How amazing the book is when it's pointing out different aspects and importance of data cleaning, and how does it comprehensively explain that in the book. A lot of people were very interested, and I realized that it's not really reaching to some of the countries. So I thought like we can have a book giveaway, and that's what we're doing for this conference. So on all the 4 days, we are going to have one trivia question, and I would be making a note of who's the fastest to answer those questions. So make sure that you're on joining through LinkedIn, because that's how I can know which profile it's coming from, and that's how I can send you that book. So if you're joining in from YouTube, please, please, please go back to LinkedIn, and in case you want to participate in the trivia. So awesome. We have a lot of folks joining in from India, England, Canada, I see. Where else? India. Oh, US, New York, Chennai, Texas. Wow, Mumbai. Awesome, awesome, awesome. This is great. So, yeah, in the initial kickoff, I just wanted to mention about like how we are going to format these sessions, and what can you get out of this. So, all the sessions again will be recorded. So, the reason that we are streaming this through YouTube is that it can be stored, and you guys can watch it later. So make sure that you're joining in through LinkedIn for the live session so that you can participate in the trivia. Awesome. And let me just brief out about the 7 different sessions that we're going to have. Today, we're going to have a talk about how AI can completely disrupt the medical industry by Eden Waller. Then tomorrow morning at 8 a.m., 8 a.m. PT, we're going to have a talk about how we can think about scaling our artificial intelligence and machine learning models by Nitin Agarwal, followed by the talk by Foundations of Geographic Data by Alexander Baker. That's at 9 a.m. PT. Then we come in together again on 9th by a talk about space machine learning with a worldwide search, which is a no code Earth and a natural disaster dataset curated from unlabeled petabyte of scale imagery. So that's going to be by Anurit Kaul. And then tomorrow, on Wednesday at 9 a.m. PT, we're going to have a talk by Anna about AI ethics in 3D. So it's going to talk about ethics of data, algorithm, and usage. Then on Thursday, we're going to meet at 8 a.m. For a talk by Sanjay Vishwakarma about quantum computing 101, and followed by 9 a.m. A talk by Dr. Beverly Wang about medication autoencoders, which is an NLP application in healthcare. So, and then we're going to finally wrap up the conference. So, as I mentioned earlier, every day we're going to have one trivia question, so which is going to happen between the two sessions. So, today we're going to have the trivia session just after the conference kicks off before you go to the talk by Ian Waller. Awesome. So if anybody has any questions, please feel free to put them in the chat. Again, we are not gonna have like just one Q&A session through the end of the talk. We are going to have the question answering during the session as well. So what we're going to be doing is we're going to be answering the questions that people put on the chat while the presenter is continuing with the session. So the presenter will be taking a pause after every 7 to 8 minutes. Then we're going to look at the questions that has been coming up on the chat, and then we're going to answer them as we go. So if you have any questions whatsoever, please feel free to put that on the chat. Now, talking about the next things that we are doing at Illuminate AI, if you haven't checked this already, please go and check our new website launch. So we have launched our new website, which is again like talking about most of the existing features that we had already. We will be resurfacing this with a phase two of the website where we're going to introduce courses for you guys. Again, as I mentioned, all the information, resources, and all the assets that you see, video, everything is free from Illuminate AI. So it's just a learning platform where you guys can tune in and follow to see the latest updates, to see what videos we are posting. So I'm going to put this on the chat so you guys can see. Let me put this on LinkedIn. Okay, here you go. That's the website. So if you haven't checked it out already, please go ahead and see. And on the same website, you can find the conference agenda if you would want to learn more about which session is happening when. So if you would want to learn that, you can go ahead to the agenda section in the website and check out the agenda. So yeah, we see some of the questions. Can you talk about the usage of AI in feature engineering and missing value treatment? Hi, Prateek. So right now we are having a conference kickoff. I'm not here to deliver a session, but of course, like I will be noting that down so that we can have that as a topic for future purposes. Okay, awesome. Shivaji, yes, this is a free learning platform. So if you have any, like if you would want to look at any resources, you can feel free to do that. And the mentoring is something that's occasional. So we put out application for people to join the mentorship program. The applications are for both mentors and mentees. So if you want to be a mentor or a mentee, you have to apply through the application, and then we have a selection process. Then we have a one-on-one interview, after which we select the cohort. So right now we are currently running through our third cohort, so the applications are closed. We will be opening up the application in March. So please have a please check out the website in March so you can see the applications open up. Okay. What other questions do we have? Awesome. Great. So, if you guys also want to follow the LinkedIn page, I can share that as well. Give me 1 minute. Let me pull up the page information. Okay. So, I'm going to put this again on the chat. So, this is our LinkedIn page. We are almost touching 10,000 followers there. So we frequently post content. So there's a lot of varied content here about like applications of AI, about technical details, about how businesses are using them in their organization, etc. So definitely like follow the page. Again, all the resources are free. So if there's anything that you feel that we can improve, feedback is always appreciated. So please feel free to email us on our contact information. So okay, so what's the name of the book for data cleaning? It's called Between the Spreadsheets. So let me share that information here as well. So here we go. Okay, putting this up on the chat. so you guys know what book are we sharing. So it's called Between the Spreadsheets by Susan Walsh. There you go. That's the book, and that's what you're gonna win when you go through the trivia. So awesome. Let me quickly share my screen. And as I mentioned, if people are joining through YouTube, please join us through LinkedIn, because that's when you'll be able to participate in the trivia, and I can make a note of who you are and your answer, so I can send you the copy of the book. So let me share my screen. Okay. So here's the first trivia question. The question is, which computer won a chess match against the human world champion for the first time? The options are High Tech, Chess XX, Deep Blue, and AlphaGo. Put in your options as A, B, C, or D on the chat, and the person who is able to answer this question the quickest will be winning the book. So I'm going to give 10 more seconds, and then we're going to see the answer. There won't be enough time for you guys to cheat, for you guys to search, because the person who's going to answer the fastest is going to get the book. So so have your answers really quick on the comments. You just, all you need to do is answer by A, B, C, or D based on which answer do you feel is right for this question. 5 more seconds, and then we're done. Okay, awesome. So the answer for this question is Deep Blue. Yes. So Deep Blue was a computer that was built by IBM as one of their research projects. And it was the first computer ever that could play chess. Not just play chess, it actually won against the world champion, a human world champion of chess. So this was a great moment when we could see what are the limits, or like, what is the extent till which we can build intelligent systems. So keep an eye out for tomorrow's trivia question. So tomorrow, between both of the sessions, we're going to have another trivia question, and yes, that would again give you a chance to win the book. So make sure you're joining the conference, make sure you're attending the whole conference for you to go through the trivia questions and win the book. So let's go back onto the platform and see who was there. Awesome. Oh my God. So many people. Okay. Wow. Awesome. So let me go up and see who is the winner for today's trivia question. Oh, guys. This is a lot of comments for me to go through. Okay. Awesome. Um, let's see. Okay. So the winner for the book is Mark Moyo. I'm sorry if I'm not pronouncing your name correctly, but the winner of the book is Mark Moyo. Let me put in your name here. Okay. Awesome. Congratulations, Mark. So I will be connecting with you, and I'll take in your information so I can send you the book. Awesome. Thanks everyone to for playing this game with us. Tomorrow again, of course, we'll meet and we're gonna see who wins the next trivia game. Um, in the meanwhile, what you guys can do is check out the agenda for the conference on Illuminate AI's website. If you have any specific questions, please feel free to put that in the chat. Also, we're going to start with our next session very soon. So we're going to have Eden with us, and we're going to start the second session of the day very soon. She's going to be talking about one of her research projects. So if you have any questions, please feel free to put that in the chat throughout the conference, because as I mentioned earlier, we will be talking about the questions. We'll be answering your questions through the session. So we're not going to be waiting till the end of the session to answer your questions. So as and when you're getting any questions, please feel free to put that in the chat. So Eden, today we'll be talking about how AI can completely disrupt the medical industry as we know it. So let's give it a few moments, and we're going to take a break for another 10 minutes, and we're going to meet here back again for our second chat. So I'll see you guys back in 10 minutes. Hey everyone, so we are back. Awesome. So now we're gonna kick off our another session. And let me remove that weird overlay on the screen. Okay, awesome. So yeah, we're gonna start with our second session. So today, the second speaker that we have with us today is Eden Waller. She is currently working at Google as an AI and ML customer engineer. She is a proud working mom whose 7 year career thus far as a data scientist has primarily focused on machine learning, artificial intelligence, trend analysis, natural language processing, web development, data visualization, and UI UX design as a consultant in the federal space. Throughout this time, she has built and deployed over 15 technology applications spanning over 54 languages. During the past year alone, she has picked up over 19 new skills and is slotted to be the next guest speaker for the Advanced Research Division of her federal client, showcasing her most recent work around natural language processing. I'm really excited for you to have you here, Eden. Hi.
I
Um, Awesome. I'm really glad that you could make out some time for delivering a session today. So I'm really happy and really thankful that you could be part of this conference today.
oh gosh, the feeling is mutual. It is such an honor to be here. I've been so excited, just watching the you progress as a person and Illuminate AI grow. Super excited to see the website launch. That was,
Awesome.
I've
I'm
been
glad you
rooting
saw
for
that.
you. So. I've been rooting for you guys. I love what you're doing here, and I'm just so honored and excited to support that.
Awesome. I'm really glad that you like the platform and like as Eden mentioned, we have launched our new website. So if you haven't checked it out already, please do so. Again, a reminder that when Eden is delivering her talk, we would be looking at the chat section. We will be looking at your questions when we are going through the session. We will be taking a pause every 7 to 8 minutes to answer your questions so that we don't leave all your questions to the end. So please put in your questions. Please feel free to ask any question that you have around the session on the chat of the comment box. Great, Eden. So I'll let you take the stage.
All right, cool.
Awesome. So
Should
you
we
want me to put in your screen as well? Are you planning to share the screen right now? Uh,
Yeah, go ahead and put that
there you
up.
go.
Should we go ahead and start? We've got 2 minutes.
Yeah, sure. In the meanwhile, maybe you can introduce, like something that I would have missed. Maybe some of your experience in the medical industry.
Sure. So I can go to my about me page here, just so you guys can get a little bit of details. You hit actually a lot of it. My position actually in Google Cloud right now is a customer engineer. I haven't updated my LinkedIn about me page, so it's a couple months out of date. But I'm in the Federal Health and Life Sciences team, so we're engaging strictly, almost strictly with federal clients, but also trying to reach back to more private companies like Fitbit, which we recently acquired. So that's I've done a little bit as far as health goes at the VA, doing uh, prediction of health outcomes for suicidal ideation for veterans that are coming back from deployment. And there we were trying to uh, discover which programs the VA had several programs that were in one way, shape, or form designed at alleviating some of the stressors that are on veterans when they come back, and trying to integrate back into society. And so we were trying to figure out a quantitative measure to assess each of those programs' um, effectiveness, essentially, for a report that was due to Congress. So that was my introduction to health, and life sciences, and I was really excited to join Google and get in back in there after quite a bit of work with Department of Energy, focused mostly on natural language processing. So Um, Personally, health and nutrition is very important to me, and then advocating to others how they can kind of use technology and the importance of it. And so we'll be going into a little bit of detail on that in the presentation. But yeah, I guess other, outside of work, I enjoy hiking. I live in the DC metro area, so you've got a lot of great hiking in the Virginia area in Maryland that I like to frequent with my son. And I love working with my hands, wood work, building forts, even all kinds of stuff. Um, so yeah, it is 12:01 now, so we are
Yeah,
officially in. So I'll go ahead
yes,
and dig into material here.
absolutely. So I'm gonna go off screen so you can get the full bandwidth. And if there's anything, like just give me a shout out. I will be back in about 7 minutes when we're taking a pause to see if we have any questions on the chat.
Cool. Sounds good.
Awesome.
All right. So, a quick disclaimer, I mentioned a little bit in my about me that I'm not a medical professional. So, my ideas presented here, they're independent from my employer, from Google, but they're not necessarily opposed to it. So, what I'm saying here is not necessarily revealing some fancy new products that we're coming out with. So, I just wanted to be clear about that. All right. So, as I said in the abstract for this talk, the healthcare industry as it stands today is largely a reactive practice. What do I mean by that? So, for many of us, beyond our annual wellness checkup that we do, we really only visit the doctor or begin some kind of at home treatment when we get sick or we don't feel well, right? So, our practitioners are essentially reacting to illness rather than thinking about how to predict and prevent it. So we can see this concept reflected in the fact that 95% of our health budgets are focused on treatment, actually treating diseases, rather than working to prevent disease from occurring in the first place. So you may be thinking at this point, well, of course, but what's the alternative? I'm not going to go to the doctor every month or, God forbid, every week if I'm not actively ill for my doctor to just be checking to see if I might be getting sick. That's crazy. And I would agree with you. It would be. And I'm certainly not advocating that you do that. But what if we started thinking more about ways that we could start tracking and predicting illness remotely before we start exhibiting symptoms that we notice, like a runny nose or aches and pains in the body, that would give us the opportunity to treat it early or possibly even avoid the event altogether? This concept is not revolutionary, it's just basic preventative healthcare. But historically, we haven't had the means to enable us to do this at scale. And this is when the problem expands from just being a healthcare industry problem and into an IT one that touches on both IT infrastructure and where and how to store data, serve models, as well as data science, which touches on the creation of models and access to the data. So now I get that preventative healthcare is certainly not a very sexy issue in the medical industry, as we can see reflected in this statistic here. And it's certainly not as sexy as cutting edge surgery or neuroscience. But in the IT industry, gathering and acting on data is a super exciting problem to tackle. So my question is, how can we, the IT industry and the medical industry, work together to support each other? So, but before we get there, let's first take a quick look at where the current practices have gotten us. I mentioned that 95% of our health budgets are being spent on treatment. And this article, published in 2019, reviewed the result of how that spending model worked out for us. This analysis is the latest in a series, actually, from the Commonwealth Fund, which is a cross-national comparison that uses health data from Organizations for Economic Cooperation and Development. You'll see it abbreviated as OECD, which assesses the US healthcare system, spending outcomes, risk factors, and prevention, utilization, and quality relative to 10 other high income countries. So those are Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the UK. So what they also did was they compared the US performance to that of the OECD average, which is comprised of 36 high income member countries. So here are some of those highlights. In 2018, the US spent 16.9% of their GDP on healthcare, nearly twice as much as the average OECD country. The second highest ranking country, Switzerland, spent 12.2%. And at the other end of the spectrum, New Zealand and Australia devoted only 9.3%, approximately half as much as the US does. So the share of the economy spent on healthcare has been steadily increasing since the 1980s for all countries because health spending growth has outpaced economic growth, in part because of the advances in medical technologies and then the rising prices in the healthcare sector across the board, and then, of course, increased demand for services. And then, despite the highest spending, Americans experienced worse health outcomes than their international peers. For example, life expectancy at birth in the US was 78.6 years in 2017, just more than 2 years lower than the OECD average and 5 years lower than Switzerland, which has the longest lifespan. Reflecting shorter life expectancy, the US has the highest suicide rate of these countries, with France as a close second. Meanwhile, the UK has the lowest rate, half that of the US. Yep, and elevated suicide rates. They indicate a higher burden of mental illness. So we'll touch on that a little bit later as well. So worse health outcomes and shorter life expectancy appear related to risk factors and disease burden. So more than 1/4 of the U.S. adults report that they have ever been diagnosed with two or more chronic conditions such as asthma, diabetes, heart disease, or hypertension during their lifetime, compared to 22% or less in all other countries. This rate is actually twice as high as it is in the Netherlands and the UK. Obesity is another big one. It's a key risk factor for chronic conditions such as diabetes, hypertension, and other cardiovascular disease and cancer. The US has the highest obesity rate among the countries studied. No surprise, really, there. But it's two times higher than the OECD average and approximately 4 times higher than in Switzerland and Norway. So, despite having the highest level of healthcare spending, Americans had fewer physician visits than their peers in most countries. 4 visits per capita per year, and Americans visit the doctor at half the rate as Germans and the Dutch. The US rate was comparable to that in New Zealand, Switzerland, and Norway, but higher than in Sweden. So, obviously, there's a national level health problem here. But for me, it really wasn't until I started being treated personally for high blood pressure that it dawned on me. Health happens in real time. And I'll get into a personal story here in just a bit. But I did want to pause here for a second for questions.
Hi, Eden. So,
Right.
one of the questions that I think people have is about the country or like the data that has been collected for different countries, right? So, if people are curious as in why it's only skewed for like European and US countries. So, is there any specific reason that like Asian countries or any other part is not included?
So, for this study in particular, their focus, I guess, was on much more um, developed nations.
Okay,
And part of that may have been access to data and having the necessary support to participate in this particular study.
got
Um,
it.
but
Makes sense.
I didn't want this to be the U.S. conditions as compared with a third world country is not really a apples to apples comparison.
Yeah, that totally makes sense. Also, I think there was one more question Okay, so what kind of apps? One of the other questions is like, what kind of apps were used to collect this data, or was it like through one particular survey that the data was collected, or was it like a crowdsourcing initiative?
No, so it was actually an official survey conducted by the Commonwealth Fund, and
Hmm.
I'm going to share the presentation slides with
Sure.
you that I think you're going to make available. Right, I've included a link to that study
Hmm.
in the speaker notes for this slide for you guys to learn more about the
Awesome.
statistical analysis approach of this study.
Awesome. Got it. Makes sense. So one of the other questions is when we are looking at this data, right? Uh, when we are looking at the data that has been collected, how do we make sure, like, how do we account for um, any kind of like biases that could exist? So when I say biases, it's more about the skewness of like who is answering to these kind of surveys, or is the entire like all the different states in a particular country were covered or not, like what's the demographic of people who are answering to these kind of surveys. So how do we make sure of that, like if there's any kind of like spatial bias, that uh, is there any specific group that's only answering to this question, is any kind of group not taking this survey, so we don't have like a whole picture of the reality. So how do we like identify that in such kind of study, and how do we account for such kind of biases that could exist?
Sure. So, in my experience, there is no such thing as a perfect survey. There are always going to be cost concerns that severely limits one's ability to collect a survey in an expansive way, especially at a scale like this. So I always just try to. So I guess if the question is if you're trying to design a study, there's a whole other hour-long talk we could do on exactly how to limit biases here.
Mhm.
And for me, for myself, if I was going to conduct a study like this, I always try and I'm not a huge fan of surveys, but they are a good data source when you have nothing.
Mhm.
But trying to get indicators that are much more unbiased, such as death rates, things that are
Makes sense. Yeah.
calculated and hard facts, as opposed to
Makes sense.
opinions like, I think healthcare is really expensive. Well, that depends on your income. That depends on, a bunch of different factors. So people's opinions about things are, those are biased.
Yeah.
So yeah, I think that this study was a good one that I came across that was better than most. It had a really good scale as far as just trying to get a worldwide depiction of
Hmm.
kind of what's
Makes
going
sense.
on.
Totally
Yeah.
makes sense. Great. So yeah, we can carry on with the session, and we can pause a little later when we have like more questions.
Cool.
Awesome.
All right. So I was saying that I myself hadn't really been paying much attention to this as a relatively healthy individual. But when I had my first scare of hypertension, when I was pregnant with my son, that's when I really started to understand that health does happen in real time. Um, I was going for my annual wellness visits and consistently getting high blood pressure readings in the office year over year, but not alarmingly slow. So, um, the first the data points were written off by me, just as outliers due to being me in a rush to getting to the appointment in the first place, and so my doctor never really took action on those. Then I ended up actually being hospitalized and having to deliver my son prematurely due to a likely related condition called preeclampsia, which is just high blood pressure when you're pregnant. And at one point during that period of my life, my systolic blood pressure was over 215 systolic. And to give you an indication of what that actually means, let me give you a quick lesson on blood pressure ranges. So for your systolic, this top number here, normal is less than 120. And over on the far left, you're in crisis if you're over 180 and you need to call an ambulance or consult your doctor right away. So when you're seeing numbers in the 215 ranges, you're starting to think, whoa, what's going to happen to me at those numbers? I didn't know that that was even possible. Um, so at one point when I was hospitalized, my blood pressure was being taken every 5 minutes. So I got to see firsthand how much fluctuation there can be in blood pressure. I had no idea about that. So I saw swings from 45 to well over 200. And all of these are bad, but in the past I'd seen numbers closer to 120, the normal range. So, of course, that prompted me to ask questions about what it meant to see numbers this high, which I could sense was bad, judging from how the slew of doctors and nurses in my room were scrambling about and yelling at each other. So I learned that high blood pressure increases the risk of stroke, heart failure, sexual dysfunction, vision loss, heart attack, and kidney disease and failure, and even in extreme cases, mortality. Fun stuff, right? So I started to get much more involved in tracking my own metrics, having realized that the hard way. Blood pressure and many other metrics occur in and develop in real time, especially for those with high risk conditions. So it's not just during our annual wellness visits, or at one point I was during my pregnancy I was visiting the doctor once a week. That's not enough. So some of you may be thinking, well, duh, and yes, it is obvious when you think about it like this. But this was a real aha moment for me because we're all human, right? And often what we know about the world and how we behave in it doesn't always match up or make the most sense. So I used to think I was being really proactive visiting the doctor once a year. But now that I've been diagnosed with hypertension, I know it's really unrealistic to ask my doctor to give me a complete holistic diagnosis of my overall health and well being with little to no data, just my annual office visit. And then, of course, if patients are like me and they wait to gather data until after a diagnosis occurs, then you miss out on all the data that led up to that event in the first place, and thus the opportunity to develop a predictive theory or a model that could help doctors diagnose other patients earlier and help your doctor understand what led to your diagnosis. So, data scientists and doctors will really need to work together to determine what health metrics are most important for us to track over time. I'll leave that to them. But even from birth, you could be tracking statistics, any kind of vaccine records, hospitalizations that we may have forgotten as adults. But how attainable is it to track and store these metrics? It's not as if we have this universal repository of health data that we can just upload to, right? So then the question becomes, how would a doctor even get access to that data, even if we were storing it? And is that even our doctor's responsibility? Did they have the tools and resources to even recommend products beyond tracking your steps and heart rate with your iWatch? What about your vaccine records from childhood? They're just relying on you for that information for the most part, as I can see it. So, who's responsible for maintaining these? Our parents. What if our parents have passed away? We lost that information. It's a whole bunch of different things. So, another aha moment for me. I need to be doing my part to give my doctor the data she needs to be making decisions. And of course, I can be doing that as a really proactive individual. And believe me, I do. But I got to thinking, how about everyone else? How can I, as a data scientist and an IT professional, use my knowledge to help others do the same? So I'd like to posit a much more proactive approach to healthcare, backed by the latest technology that provides physicians with the longitudinal data they need to make well-informed diagnoses and predictions, and patients with the care they deserve. By bringing medical AI into our homes and providing our human doctors with unbiased, robust data to make informed decisions, it can take preventative medical care to a whole new level. And let's not wait until we're sick to gather data and treat ourselves. So before we get into actually the mechanics of how we would do that, I wanted to take another pause here and just get some reactions, see what's going on in the chat.
Thanks a lot, Eden. So one of the things, like when you were mentioning about, like to provide, like real time data to the to healthcare professionals. So what do you what is in your experience is one of the reasons that there's friction, like on adoption, right? So you might have when you were discussing this idea, you might have faced pushbacks at various points, right? Like, so what were those reasons, and how could you persuade them that yes, this is the right solution, and how to make sure that like any kind of how do I put this, um how to make sure that there's no issues which is related to like using the technology in the solution that you were looking at.
So we'll get into a little bit more finer detail of all of those and later in the presentation. But I'll just
Mhm,
say kind of quickly that this is a tough problem to solve because it has so many different components that have to work together from federal level to think about like Fitbit is one small company that's trying to make an impact in health metrics on wearable tech. um, and so if a company is not big enough and has enough resources to really push forward some type of uh, some type of kind of longer term and more expansive kind of way to increase adoption, it kind of falls short there. So it's you see, so that's why like Google acquired Fitbit. So that's
yeah.
a really meaningful pairing there that could take advantage of the
Yeah.
resources that Google has, and maybe acquire a couple of different pieces of technology that enable that the data storage, for example, that needs to be that all needs to be maintained at scale. And for a small little startup, that's a really huge bridge to cross. And there's a lot of companies out there that we'll get into. They're already trying to bridge that gap, but it takes years to develop this kind of stuff. And
Mhm,
from the federal level, getting budgets to actually funnel down to make any kind of real progress as far as data privacy and sharing. There's a lot of sensitivity with federal organizations and privately held companies that
mhm.
that's their a huge value for them is their data, and they're not going to be like, oh yeah, sure, let's just give this out and I'll let you monetize it yourself. People aren't really willing to do that.
Yeah,
So yeah, we'll
makes
get
sense.
into that in a little bit more detail. But does that make sense?
Yeah, that makes sense. Great. Yeah, I think that's all we had. Okay, so yeah, I think we have a few more questions. So okay, so Shivji is asking, how does AI diagnosis? Okay, give me one second. Let me just go through this. Okay, so David has a question saying that perhaps like de-identify data to simply compare a given patient to a valid comparison set. There's not incentives to share data. Uh, More people would fear fee increase. Okay. David, I would really like I would really hope if you can rephrase that question because I'm not very clear on what you're asking for. So if you can just rephrase your question and put that back in the chat, we would definitely like to answer that. Okay. So one of the other things Andrew is asking is about data quality, right? So how do we ensure data quality in this situation? Because there are a lot of manual processes involved, which like go over some patient data, etc. So how do we ensure that data quality is maintained here, and how can we what can we do to improve it?
Sure. So that's a great question. So if you look at, let's say, like calorie tracking, could be something that people would really be interested in, but that's relying on the user to go and put in their food data accurately,
Mhm.
which would be probably a bad idea to be making a model off of that because no one's gonna. People are just it's labor intensive to go through and do that, and um, that would not be a reliable data source. That's where I was mentioning getting away from voluntary data from data sources that rely on humans to actually decide to to give it to you in a reliable fashion is, in my opinion, I try to stay away from that. So,
Yeah.
um, so like your steps on your watch is relatively reliable, but it also depends on the user actually wearing the watch consistently. Um, so I guess what you would do in that case is when you develop the models, you would develop them in a more controlled environment
Mhm.
with participants that, sign some kind of a waiver saying that they promise to wear their watch so many hours a day and only take it off when they're showering. That way, you make sure that you get really good quality data there, and trying to focus on data points, like the heart rate, like, there's continuous glucose monitors out there right now. They can give you a sense of your blood sugar
Mhm.
levels, and then, above and beyond that, you could try and get um, uh, some type of data that's, we'll get into some particulars actually on that a little
Mhm.
bit later. I want to give it all up
Yeah.
here. But yeah, you have to be really careful with that. And there's a
Yes.
difference between deploying models on the devices and then where you're actually training them, and controlling your data
Yeah.
um, very carefully in the training phase. So that's where, federated data and all of that could or could not be useful depending on what the metric is and how much you can really validate that the watch was actually you could always throw away data that you could tell if the watch is on the person or not. You could always throw away data that, looked like it was sparsely populated, things
Got
like that.
it.
There are
Got
other
it.
ways.
Got it. That totally makes sense. Awesome. Yeah, I think that's all the questions we have so far. Yeah, we can go ahead with the session.
Cool, cool. We do have time. Okay. All right. Get back to my screen over here. All right. So the question is, so how do we actually do that, and what are the steps we need to take to get there? So I don't think that we're going to be able to solve this problem here today, and I'm not coming to you with a foolproof plan, but I am coming to you with a construct for how to start thinking about how to solve this problem over time. First off, we need to be saying yes to preventative care. This is foundational, and we can't keep pushing this to the bottom of our priorities. The data are proving this to be a very unsustainable model, as we saw previously in the presentation. So we also need to be asking ourselves, how can I personally contribute? I know that for me as a data scientist, I know that I can add value here, but in a very small part of the process. So how can infrastructure specialists, let's say, and healthcare advocates, administrators, researchers in hospitals, and physicians, what part can they play as far as advocating up at the top level? If we start to really see these two foundational pieces as something that we really want to work towards, even if it's increasing our budgets from 5% to say 10 or 20%. That's a huge gain. It doesn't need to be completely flipped and reversed. But then we can start digging in and really making progress. So next, we really need to just start asking some relevant questions that we need to get the ball rolling, and in some cases, keep the momentum going in companies that are already making progress in this area. So first up, who are the biggest players and influencers, and how can we support them? So this could be anybody and everybody from policy level, federal government agencies, CDC, NIH, state, local, national legislators, national advocacy, and nonprofit organizations, all the way down to individuals, knowledge, attitudes, and beliefs. So I know that for me, for myself, at Google, the Health and Life Sciences group is working with NIH to try to support researchers with compute resources and space, and just a way for them to get and start sharing research with each other, give them access to the data that they need to be answering their problems. Um, we're paired with Fitbit, so there's knowledge sharing that could happen there. But there's several different components to consider here. There are independent researchers like Derek Yacht, he's a global health advocate and he's self-employed. So even individuals like that could be super pivotal here. Um, or the organizational level here, healthcare systems, academic and medical institutions, of course, could be super helpful as far as just try to rethink their budgets and start just spending um, on tools instead of a brand new MRI machine or tech that's used at that point in the treatment process. There's a lot of really cool AI that's coming out that's trying to remove the doctors from the process of reading X-rays. They've proven that AI is actually far more inept at reading X-rays and making diagnoses in certain areas. So, but that's kind of too late in the game. So we have to try and allocate some funds for, okay, how do we start getting data so we can actually understand when someone, 30 years down the line is going to get lung cancer. As I said, if you wait to gather data until too late, you don't have training data. And we as data scientists know that that's a huge barrier. So yeah, just trying to think about how research institutions can play here, coalitions, thinking about health disparities as well are all super critical. And then strategic partnerships, like I mentioned, Google and Fitbit teaming up are really cool. Love to see more of those. And then some of the biggest players with the most money to be spending on this, top 10 healthcare AI companies. Notice the top two there didn't start as healthcare companies, they're IT companies, right? So they're not necessarily focused on health, but they open up these sub areas of their organizations to focus on health. So, so seeing more of those, and then figuring out how to support these agencies with some type of federal funding, grants to push research forward in that area, and divvying up budgets that focus on that can be really helpful and impactful. And of course, getting buy-in from the top healthcare companies. They could cover costs for individuals looking to take preventative healthcare measures, like subsidizing devices, especially for at-risk communities, those who are underserved. That'd be amazing to see some type of benefit there. Those who don't have, they have to drive 100 miles to get to the nearest hospital. How can we help out those people? All right, so next up is, well, I guess should we, let's take a pause for questions here before we get into the next section here.
Awesome. Thanks a lot. Yes, we do have a few questions here. So one is about implications of AI biases, especially in this sector, and what is being done to eliminate these kind of biases, or reduce the results which are resulting from these kind of biases. So especially with democratizing healthcare with AI.
Sure. So, eliminating biases in data collection, or like in applications of who's actually getting the benefit of.
I think what we're talking about here is like data induced biases. So any kind of biases that we see in the model prediction because of any kind of biases which could exist in the data. So as you mentioned, right, like the data collection, it could be a challenging task. Um, when we are trying to accumulate data from like all different categories, right, similar to what we saw earlier when we had like data sets from like US and other European nations. So when we are trying to like collect these data, and when we know that there could be biases that exist, so how do we make sure that like these biases don't reflect on the model that we are working on?
Sure, great question. So, that I would think we'd really have to lean into our research community who's actually designing those studies and collecting the data, and just make sure that there's statistical rigor in how they've stratified the population. And I think nowadays there's such a, a big community developing around health equity, so that we are now pushed to really think about how race plays into one's likelihood of developing heart disease or diabetes. How does one's access to healthcare, number of miles to the nearest clinic, let's say,
Got it. Yeah.
uh, could all be part of, if you study survey design analysis, there's a whole set of rigorous thought that goes behind what factors you want to stratify, and to make sure you have a balanced data set on the right
Mhm.
factor. So those
Yeah.
those were a couple, but there are more, and I think the more that we get educated um, on what those disparities are that may present some analysis. Like, it's tough to access people who live in rural areas to participate in the studies, right?
Makes sense. Yeah.
That's a super at risk area of the community. So, but then you think about, okay, well, we have to pay someone to go out there and collect that data, and then B, are those people even going to be willing to talk to somebody? Do we have the right, are there language barriers to actually collecting that data? There's the very complex set of questions that one asks themselves when they're designing these studies, and
Hmm.
leaning on the really foundational research communities like the NIH, that is well known
Yeah.
for doing this, is where you get the most rich data sources, and they've proven themselves, I think.
Got it. Got it. Got it. That makes sense. And I think one of the other questions was presently, right? Like we have a lot of compliance and governance around medical data, especially like HIPAA privacy rule for an example, right? How do you see like the governance part or the policy part is improving to accommodate AI models or like AI based applications in healthcare?
Cool. Yeah. Awesome point. And we'll get into that in a little bit, but I'll just kind of give a little preview of that. So, federated data, or federated learning is one piece to that, which just means that uh, not all data is being
Mhm.
sent back to the big repository where it's actually being used to train like a national model.
Mhm.
So,
Yeah.
data is actually stored on the user's device, and so there's no privacy concerns because just the model weights are being sent back, and not the actual data itself.
Yeah.
So that's we've made a lot of advances there just in the last several years, for years.
Mhm.
Um, and then, we talk about like some things that seem like really kind of simple, or just like masking data. So why can't, I think one person brought up that, why can't you just mask the data, strip out personal identifiers, and
Yeah.
then just give it up to the public? So that's a tough one for me. It seems super obvious, but it's, there's a whole hierarchy of
Yeah.
federal folks you have to work through to get them to kind of give up that and trust that there is not going to be a breach. And oh,
Yeah.
how stupid would we look if we did give up the data and some hacker was able to trace it back? And then, there's all kinds of like fear around
Mhm. Yeah.
that piece. So that's where it becomes a federal legislative kind of on the hill kind of conversation, to just
Yeah. Yeah.
get to a point where we're
Mhm.
comfortable sharing data, because it's, if you're in the IT industry, how kind of easy it is to,
Yeah.
how reliable the security is, and you can quantify it. And yeah, it seems kind of easy, but it's, that emotional piece, I
Yeah.
guess, that's hard to get over.
Makes sense. Makes sense. Totally makes sense. Awesome. Yeah, I think that's all the questions we have so far. And yeah, you can continue with the session.
Cool, cool, cool. All right, so we've touched on this a little bit, but data democratization. This is, as I mentioned, it's a tough one, um, for the reasons I mentioned. But if we really got comfortable here and it became um, just not such a taboo subject, to be democratizing data and giving. There's a lot of monetary value tied up in data democratization. There's a lot of people who are making a lot of money on this, and if they then start giving that up, it's like, okay, you're just taking money out of my pocket. So, um, there's both a public sector and private sector question that needs to, or issues, I guess, that need to be worked out there. But that's where federal agencies can really help because they're not trying to profit off of this, right? It's for the general good of the public. So yeah, public-private partnerships. How can we work to kind of incentivize data democratization, especially financially? And then, so that's really going to drive the discovery. If you're a research scientist, you know how hard it is to get longitudinal data that's reliable. There are very few studies out there that have been able to do 10, 20, 30, 50-year, lifelong studies of a human. Because that's we didn't have the technology back then to be storing all of this data anyway. But now that we are, maybe start thinking about that. But if we start doing it, some of that data storage, collection, and housing, and we have a lot of the resources here now that are ready for us to take advantage of. It's really just getting organized around it and giving people a space, platform, what have you, to start doing that, and then developing partnerships with research institutions that could help start driving discovery and innovation, and develop more accurate diagnoses, and of course getting unbiased data points. Tough, as those are not easy problems to solve, but I just want to put it out there that what a global scale of this could kind of look like, so that we can start answering those questions little by little. But what would it look like if we started collecting and storing data, medical data, at birth? When I look at my son right now, if anything were to happen and my data on my phone got wiped, I would have no idea what dates he got what vaccines to tell him later in life, so he could tell his doctor, oh, did you get chickenpox vaccine? That's an important one to know about, right? So he should be able to know that. I should be able to pass that along to him. He should know what my metrics are. I learned recently that my dad actually has hypertension as well, and my grandfather. So it's hereditary. That would have been useful to know. And if he, hadn't been around to tell me that, I would have never known about that. But it's really important for our physicians to have access to that data, so that they can understand an entire history of our lives, and how childhood development affects adulthood, especially psychological factors, not just more medical ones. It's largely untouched, this area. Obvious privacy concerns and sensitivities, so it'd be a lot of work to try and develop a model that would make everyone comfortable, from citizens that are participating, to physicians, to researchers, everybody. So we touched on this, the federated learning. So advancements here, actually, I think I've already touched on this, so I'll go ahead and skip over this one. So as I mentioned earlier in the presentation, for those with high-risk conditions, health happens in real time. And now we finally have the means to actually make real-time analytics a reality with the advancements in IT infrastructure. So it's really just a matter of finding a cloud provider partnership to make that happen at this point. It used to be super expensive or not possible at all. Now that it's a reality, it's really just kind of finding the right puzzle pieces to put in place with the right application to just bring this whole concept to a reality. And then, of course, that begs the question, that's where the infrastructure as a service really comes in to play here, in addition to real-time streaming. And you need a vendor to provide servers, data storage, networking, model training and deployment services, security, metric tracking, just to start with. So, of course, all of this costs money, but I wonder how much money we would save compared to how our previous spending model that focused on treatment would fare. My bet is that this spending model would be much more efficient. All right, so the next question is how can we enable progress? So maybe we could just take one more question here and then try to get on so we can finish the presentation. Is there anything burning in the chat?
I think we're good so far. So one of the only questions I see here is, um, are we talking about only like wearables, or is it any kind of like medical industry specific equipment? So is it only like compatible with wearables, or is it only compatible with the devices that's available in the healthcare premises?
So, good question. We'll get into that in just a little bit. If you'll hang tight,
Okay,
we'll touch
awesome.
on. All right. So, um, first up into how can we enable progress? You may be surprised that I'll touch on this, but I'll get into why. So, first up is advancing neuroscience research. Why do I say this? So, so that we can build on the knowledge that we learn here into our devices first and foremost. So one of the big names right now, or growing name, I should say, is Dr. Susan Pierce Thompson. She's one researcher that I follow that has made significant strides just over the last few years in the science of eating healthy, which she's a neuroscientist, but now she owns her own company that's um, it's for profit, but she's got a research arm of her organization that's focusing on participants of her plan that focuses on the science of healthy eating. She's developed this construct for how changes in the diet um, affect everything from odds of sustained weight loss long term, which is really tricky and a critical component of our overall health and well being. Mental health, there are people who literally say, like, within a week of just doing simple things like removing processed foods completely from the diet and eating on a scheduled um, intervals just lifts mental health fog. They get off medications that they're on. They stop having suicidal thoughts. They sleep better. Their energy levels are better. Chronic illnesses start lifting, like diabetes and hypertension and joint pain and inflammation and a whole slew of other metrics that I think she's tracking on an individual basis. Some of those are more qualitative outcomes, but she's kind of at the forefront of this breakthrough way of just applying very simple neuroscientific research on the effects of eliminating processed sugar from your diet, no flour, eating only 3 meals a day and not snacking throughout the day, and then controlling your quantities. Just those four things have had a substantial impact. So once we know what methods work for sustaining healthy eating habits that affect our overall health in many ways, then we can start to track and act on metrics around them. We'll get into a little bit more about how you can actually do that. But one example that's well known is dopamine, which is an element that's produced by our brains that starts playing a starring role in motivating behavior, especially as it relates to eating habits. So we now know that we get a spike of dopamine as we receive a reward, this unexpected reward, um, like eating a cupcake, for example. And when it's unexpected, that's when we are in the learning phase of habit development. So then, once we know how good a cupcake tastes and how good the rush of dopamine feels when we sink our teeth into them, we actually get a hit of dopamine before we bite into one. So in an evolutionary context, this rewards us for beneficial behaviors and motivates us to repeat them. So eating, just anything, is good for survival, right? But then we cross a point where we eat too much. So then this type of behavior has the potential to become a predictable event when the cue is actually happening and the dopamine spike is is occurring actually before the reward. So, I don't even know if it's possible to be tracking dopamine remotely in a wearable device at this point. But we do know how to measure it in the lab. So, it's just a matter of time before we can actually do that. But what if we could take action on that prediction, like giving you an alert, like don't eat the cupcake, or call a friend, go for support on your social media application to not do that, take that action. If it's eating eating healthy, it could be a drug addiction, any kind of addictive behavior that's not good for our overall health. Go for a walk, for example. Then, of course, there's work to be done to figure out how this brain signal differs, of course, from one that's maybe addicted to something healthy. Like might get a dopamine spike before we go for a run, for example. So I'd leave that to the medical professionals or even the data scientists to try and figure out how that actually looks different in our brains. My hunch is that it might look different, but yeah, that would be a huge challenge here scientifically. But that's where partnerships with cutting edge researchers like Dr. Susan Pierce Thompson could come in handy. She's been studying this for a long time, and she even uses tech as one tool in her toolkit with her study participants, just as a means of developing strong community and support around them, which is shown from a neuroscientific perspective to be extremely important as it relates to long-term adoption of healthy habits and sustaining healthy living goals. Tend to isolate when we're not on track with our health goals. So you could use even something simple as Facebook, other platforms. There's a lot you could do there. So, and then another bit of research that I've found super useful and that I've seen leak its way into app development is a book by James Clear called Atomic Habits. This idea isn't novel, but I just wanted to highlight it in this context in the hopes that monitoring our health can become as addictive as maybe checking our TikTok or Facebook feeds. Some of the rules of behavior here that James Clear highlights are that for a habit to be a new habit to be adopted, you have to make it obvious, attractive, easy, and satisfying. So that would translate into some apps that are gamified and easy to use. If we see how addictive we get to our Facebook feeds, why not for some kind of health app? So another concept I think is important is understanding in this context is confirmation bias. So it's the tendency to search for, interpret, and recall information in a way that supports what we already believe. So if I believe that I'm generally a healthy person, I'm more likely to paint a rosier picture of my overall health to my doctor, and vice versa. If I'm someone who's generally thinks that I'm not a healthy person, which you get into health disparities, that's where this issue kind of comes to light here. I'll tell my doctor, oh yeah, things are terrible. So having an unbiased data source in someone's hands can make them far less likely to feed into this and fall prey to this phenomenon in either direction. Like in my case, when I was telling my doctor about my high blood pressure, I'd always write off that metric to her, like, oh, don't worry about it. I'm just stressed today. My blood pressure is elevated. But that was several years that happened. And she would believe me because she's my doctor and, why not? So if I had much more clearer data in my hands, I could clearly see, oh, actually my blood pressure is over 150 pretty much consistently throughout the day. And then I'm educating myself. So then, of course, considering disproportionate access to the services and technology that are made available, it's another crucial thing to consider here. Health equity is a taboo subject today, and one that's getting a lot of attention for just cause, for really good reason. And this is where health advocates and public-private partnerships can play a huge role. So, certain communities have uh, access to $1,000 iPhone, for example. They pair it with their iWatch, or a couple $100. Um, yeah, it's easy to keep track of your steps when you have the funds to be spending on devices like that. But perhaps there are ways to make devices a little bit more affordable. Um, Government subsidies, programs that could help everyone have an equitable opportunity to be getting resources to help them have an impact on their personal health journey. Another kind of fun one here is using the psychology of conformity for good. So the psychology of conformity is something that we've previously explored, and it's in the study dates back to the 1950s that I'm showing here, so it's in black and white. It's Gestalt scholar and social psychology pioneer Solomon Asch. Today we know this as the Asch conformity experiments or the elevator experiments. Is one of the crucial ones here that's most well known. It was originally conducted as part of a 1962 Candid Camera episode titled as Face the Rear. So it's the idea was to stage a group of individuals that are facing backwards in an elevator when a new unsuspecting rider comes in. They keep remaining facing backwards, and then if they leave the elevator, they back out of the elevator ride. So what does the new rider do? He turns backwards eventually in the elevator just to be like everyone else. He looks puzzled at first, but he does it. So the conclusion of this study was that we have an inherent need to conform to expectations. So how can we actually use this understanding to create a culture of best practice around health that makes people turn around to a more healthy lifestyle? We've seen this concept used for not so great purposes, but what if we used it for good, much like how we did for smoking? So smoking is now seen as gross, right? It used to be seen as really cool or something that was not healthy. And now our community has just kind of gotten around to really kind of demonizing smoking. Right, so we're coming up on time here. This is the last piece and the most important one here. So let's see if I can get to it here. And so this is the last one. And it's about how to enable progress by bringing together the AI models, infrastructure, which we touched on earlier, and the data. So these boxes here at the bottom are either already in existence today in various forms of maturity, or they're fully functioning. So as we've seen in the miniature camera on the mirror, that can be placed just around just about anywhere. And we know how to create these types of small mirrors that are deployed on the edge models already, but I haven't seen one yet that's marketed as some kind of a health monitor that links changes in your facial features to healthy outcomes, health outcomes like increased risk for a heart attack or liver dysfunction, for example. That could be really cool. And I've actually read studies that have discovered these linkages and can actually tell just by looking at your face that you may be at risk at experiencing a heart attack pretty soon. It hasn't made it into any mainstream applications that I know of, but let me know if you've seen something. But yeah, nothing that's super portable anyway, maybe in a hospital, fancy hospital someplace. All right, so the other two boxes here are already on the market, wristbands of various types and quality that measure heart rate, steps, and approximate blood pressure. And then this last one is actually a product by Verily, and I think there's a couple of other companies out there, but it was formerly known as Google Life Sciences, this Verily. And it actually has come out with the continuous glucose monitoring that can be done remotely, but your doctor has to prescribe it to you to get one. So anyway, the point is, while all these products are super useful as separate units, but think about how much more useful they could be if they were all tied together to create a much more holistic view of a person's overall health. One database, merging everything together, democratizing that data, giving it to researchers, um, streamed, stored remotely, securely, could support federated learning, um, and real time alerts to people. This is where my head was really at when I first started thinking about this concept of AI, um, and it's preventative healthcare. But yeah, we're actually at 1 o'clock. Do we need to go ahead and wrap up? I've got just like one more
It
slide
would
here.
be great if we can wrap up in another 5 minutes, but I think yeah, we can definitely like exceed a little bit. That's okay.
Okay, I think I've just got one or two more slides. I'm almost to the conclusion here. um, so yeah, this is where my head was at when I first put this concept together. But if you caught my talk at the Abby Award presentation, it was about meaningful AI and thinking more big picture about your health, about um, your AI models and applications. So that's why the focus of my talk, it's in the title of my presentation, it was on AI. But why did I wait until the end of the presentation to start talking about it? So to build these meaningful applications, we've got to pull our focus back and incorporate all the factors that I laid out previously to really be successful. I've seen a lot of data science projects fail or never leave the laptop that it was created on because the team, culture, or infrastructure wasn't there to support it and foster adoption. So it's critical that data scientists think a few or many steps ahead to what they're developing and what it will become and how it's going to be used. Um, and what if we could learn the very early indicators of when an individual is about to get sick, days or even years out? This just general data science model of um, individual patient variables, training, outcome probability. If we don't have the data to do this, it's not possible. Um, so, maybe we could say, okay, you need to go get a booster, you need vitamin C or other supplements to ward off an illness that we're tracking in real time. Um, I believe that this could even extend to mental health prediction and detection as well. Fitbit's already doing research there to see how they can track and predict that. Think how many lives could be saved if we shift to a model like this. This is where I think part of the challenge is one that the big tech giants like Google and AWS and others can help solve, which is just putting devices in the hands of consumers to help them remotely monitor their health and enable them to be able to share metrics over time. So I guess my goal, if I could summarize, is just making real-time predictive medical practice affordable, standard practice across the industry, accessible, and secure. And I'd like to just end with reiterating this slide, calling on you to ask yourselves, what can I do to contribute to make the world a healthier and more well-informed place? Thank you so much.
Thanks a lot, Eden. This was amazing. So one of the things I would like to, convey to the audience is that I know this was a lot of information that Eden shared, and this is really good information, which I'm sure like a lot of you might want to have a resource on, or you might want to access the deck again to learn more about like each and every topic that she mentioned about. So don't worry. Two things: this call will be recorded, so all the sessions happening in the conference will be recorded and you can see it afterwards on YouTube. Also the text that's being shared here will be accessible to you under the description section. So once the conference is over, we'll be collecting all the text from all the speakers, and then we'll be sharing that and the description of the YouTube video that will go out. Thanks a lot, Eden. It would be wonderful if you could also, share any other resources which you find could be helpful for the audience, and we can definitely attach that as part of the reading material later.
Sure, absolutely. I've got a bunch of links embedded in the speaker notes on just about every slide where I got the
Awesome.
information and all of that. But
Yeah.
yeah, we'll
Awesome.
take
Awesome.
it.
Awesome. Yeah. Thanks a lot for this wonderful talk. It was really helpful. It's really important to see that, what are the challenges that we actually see when we are trying to implement these kind of solutions in an industry like healthcare. What are the different kinds of friction bottleneck that we see? So this was very, very helpful. So this also gives all of you, like a good overview on how things work in healthcare industry. And if you're interested in the field, if you're interested in data science and would like to explore, then this could be one of the industries that you can be looking at. So thanks a lot. This was very, very helpful, Eden. And for everybody else, as I mentioned earlier, we have split up the conference in four days, so it doesn't take too much of your time in one single day. So we'll be coming back here at 8 a.m. PT or 9:30 p.m. IST or 4 p.m. GMT. So we'll be here tomorrow again, starting with the new session, starting with the new speaker. So stay tuned. And as we had the trivia today, we'll be having one tomorrow as well. And again, congratulating Mark for winning the trivia question today. He'll be receiving an ebook of Between the Spreadsheets by Susan Walsh. So thanks everyone. Thanks a lot, Eden. Thanks a lot again for
Of course.
taking out your time to have this talk.
Of course. Thank you for having me, and thanks, audience, for your great questions and interaction throughout the presentation. It was great.
Awesome. Awesome. Have a great day, everyone. Have a good day, Eden.
All right, you too. Bye.